Hi everyone, welcome to Center of Balance Live. I'm Phua from Center of Balance, the acupuncturist. Well, today we're going to talk about JIYI Acupuncture for scoliosis. Now, have you been following my Facebook page and in my clinic page or on my acupuncture Facebook page? And you probably realize that I have been posting a lot of scoliosis cases before and after treatment, right? And you can see it quite clearly that there is a huge improvement after the treatment, right? Today we're going to talk about how JIYI acupuncture for scoliosis treatment. So if you are on my YouTube video right now or Facebook, please give me a thumbs up and like my video, and as well as share this live video on your page. Thank you very much. And let's talk about scoliosis. So what is scoliosis? I have a spine in here that I hope you can see it. Now, if you suffer from scoliosis, I'm pretty sure you know what's going on. But for those you're not quite sure what scoliosis is, and here I'm going to talk to you. I'm going to share with you this information. And if you know someone, your family members or your friends or even yourself that suffer from scoliosis, and the good news for you, and acupuncture could help. But not all acupuncturists can help you, right? I'm going to share with you later on. So scoliosis is an abdominal curvature of the spine. Well, this is spine, right? This is in the front. This is front. This is the back. See, back in here, front in here. Right? So the normal shape of the a person's spine includes a curve at the top, right, of the shoulder, and a curve at the lower back. What that means is in here. This is a small curve. This is another curve in here. Right. This is one in here, the other one here. So basically, it's in here, and as you can see here, this is a curve. Right. This is from the sideway. A person like this is looking that way. You see, this is a person, and the spine should be that way. All right, person facing that way, spine's like this. Okay. So if your spine is curved from side to side, or in an S or C sharp, you might have scoliosis. So what does it mean? Now you can see the curve in here, right? Which means the curve is from the front to the back. That curve, that is a natural curve. That's a normal one, all right? So person staying like this. This is the curve. That's a natural curve. Well, if a person facing to me, that this is that way. What you can see right now is should be straight. That shouldn't have any curve at all. It should be straight. Yeah, straight. This is normal. This is normal. What happened in here is, if you can see that from where you see, it actually go that way. Or this should be straight like this, but it become this, and that's not straight. Right? That become a C, or like this, or one like this and the other one like this. It become an S. Right? Or like this. It should be like this. It become this, or this, which is from side to side, and that we call scoliosis. According to the American Association of Neurological Surgeons, which is AANS, about 80% of scoliosis cases have no identifiable cause, which means no one knows where it actually came from, right? So the condition is often diagnosed during the first 7 years of the child's life. So common causes when they can be pinpointed are birth defects, neurological uh, abnormal uh, ab- abnormalities, right? Genetic conditions, right? Genetic conditions or birth issues. So now let's talk about what symptoms, okay? What should we look for, right? Symptoms vary depending on degree of the scoliosis. So common symptoms associated with scoliosis include one shoulder blade that higher than the others. So which means one actually higher than the others. That can cause that because one the spine pushes one way and that one comes out. If it pushes that way, that one may come out. You see what I mean? It's mainly on the thoracics. It pushes that way, that one come up. Push it that way, that one go up. Because when it push on the scapula push it up in here, right? So one shoulder blade that stick out more than the other. It can stick out here more, to the back side more. It could be that way, okay? Um, Uneven hip. So hip one side is higher than the other. That's uneven. They should be the same. Rotating spine, which is rotate. It's a bit difficult to show you what rotate means. Rotating spine here because I don't have an abnormal spine for you. Problem breathing because of reduced area in the chest for lung to expand. So if that is pushing that way, the spine in here pushing that way, and that side of the lung, it can't expand because of that. And you may have feel that difficult to breathe. And back pain, of course. And back pain could be in here, here, and here. It could be upper back, middle back, or lower back. One of the others, okay? But I want to tell you, not everyone would have symptoms. Right? Some just feel a bit tightness. Recently, yesterday, I have one patient came back after 5 acupuncture. Now, when I say acupuncture, I use JIYI Acupuncture. So I found that JIYI Acupuncture is fantastic for scoliosis. And after 5 acupuncture with that patient, she's from actually Auckland. She's from Auckland. Drive about 1.5 hours to see me. I get her one treatment weekly for 5 weeks, and after that we took some picture before and after. We look at it, and she told me that she was 160 cm. Then after 3 treatment, she realized that she actually getting taller. She actually measured herself. She is now 161, and she told me that because of the spine in here, the curve pushing over there, and she could actually feel that under the armpit in here, close to the chest, she can feel the what we call ribs as you pop up a little bit because the spine pushing over there. And since the acupuncture, after 5 treatment, that going in a little bit. That's why it pulled up this, that went in, so no longer pushing out that bad, alright? So that's going in a little bit, so she get taller for 1 cm. That is actually pretty good, and she didn't have any symptom. I want to tell you, she didn't have any symptom. So why is she coming for? Why did she came for acupuncture? because her father want her to come, and she did want to help because she worry about it that may get worse. If she doesn't get treated, this may get worse. As that getting worse and worse and worse as she age, and that degree get worse, and she may suffer from back pain. Could be upper back, middle back, or lower back. And she may suffer from breathing issue if the curve when worse that actually compress the lung, then that will be happen too. It could be any other symptoms that we don't know. We don't know. But yes, JIYI acupuncture can prevent that happen. Now, how do I know that it can prevent it? Because after acupuncture, it actually make her longer now. Not mean longer, taller. Okay. Okay. So how could JIYI acupuncture help? I want to explain this. Okay. Most people, most acupuncturists will tell you that acupuncture work on energy, increasing blood flow. They're all truth, and I do agree with that. We stimulate meridian, right? But I also want to tell you that acupuncture work in this case because acupuncture can work for structure issues. Acupuncture can work for the tight muscle, the tendons, actually loosen up the tight muscle and tendons. Okay, we are not needling the bone. Okay, when you look at it, it seems like the bone issue, you know, and actually not. It's the tendon and muscle, one side tight and pull it over. Like this side muscle tight, it can pull this spine over. So what we do is we release the muscle on this side and let it go back to the center. All right. It doesn't work for just one treatment or two treatment, right? We test it out. In this case, I tested out for 5 acupuncture treatment, and the 2 or 3 acupuncture treatment, she felt the difference. And we always take photo before and after, right? And we do a re-examination and to show the picture whether it's whether it make a difference, and we measure the height of you and to see the progress, right? And again, I don't guarantee that I can make it all straight. What we do is we want to prevent it to go worse. That's the first thing, right? So by doing this, we can see the change. We may not get it completely straight at all, but if after acupuncture, after 5 sessions, then acupuncture help, even just a little bit, and that's good. That's worth it, because then we can work it out how often should you come for treatment. Normally we work it out for maintenance once a month to prevent it to go worse. That's it. That's what we do, right? Then if anything, we wanted to make it better, right? So if the curve is like this, that's very bad, right? So we can make it like this, you know? So that's good. And it may not go straight like this, and that's okay. We wanted to stay here and stabilize in here. And that is the best we can do. Then we turn it to maintenance, right? So we normally see you 1 or 2 treatment weekly. After 5 treatment, then we reassess. If there's improvement in your case, then we keep going. We cut it down to once every 2 weeks, once every 3 weeks, once every month. For maintenance, once every month, once every 2 months. Once we find out that the acupuncture no longer can make any further of a spine improvement, that would make it into maintenance plan. I hope that makes sense to you, right? So, but we first need to test it out whether acupuncture help or not. And I want to tell you, most of the case, it works. All right. Now, I hope this help. This information, because a lot of people want to understand how acupuncture help, and that's my um, uh, uh, explanation for you. And I hope this help. And JIYI Acupuncture is, I've learned a lot over the years. A lot of different type of acupuncture. In JIYI Acupuncture is one, the only one that I actually figured out that help with scoliosis a lot, without any manual therapy, without any exercise at all. But I'm not saying that manual therapy is not good for you. I'm not saying that exercise is not good. But with a proper exercise or manual therapy, it is good. But we find that acupuncture itself can help a lot, and it's simple, right? It doesn't suit everyone. If you're afraid of acupuncture, that's not going to help you, right? So first come in, we do an initial examination. We'll let you know how we can help you, what is the process, and how much it's going to cost you, something like that. So come in for initial examination and book an appointment. Our phone number is 07846 7956, 07846 7956. Thank you very much, and have a good night. Bye-bye. Stop this.